How familiar is this to you? Lower back pain that reaches down your legs. Well, it's something a lot of you could be experiencing right now. And a common cause of this, by the way, is something called sciatica. You've probably heard of that. Dr. Rudy Gari from Florida Pain Relief Group joins us now to explain what it is exactly. And welcome back to you, Dr. Gari.
Thanks, Jerry.
So we hear a lot about sciatica. What is it? What causes it?
So sciatica basically is a shooting pain, shooting sensation that goes from your lower back and shoots often all the way down to your foot. The reason it's called sciatica because it often involves what's called the sciatic nerve. And the sciatic nerve is a large nerve that it's your main nerve that goes to your leg. And often it's caused by some sort of an inflammatory process. A lot of times it's a bulging disc, it's a herniated disc, you twist it the wrong way, something is impinging, causing inflammation, and you get a very severe shooting sensation. They can be very, very debilitating.
So a lot of things can cause it, but it's generally related to some sort of a nerve issue.
There's usually, so what I tell people is, if you ever hit what they call your funny bone,
yes.
so you kind of, when you push here,
yes.
so it shoots down to your fingers, right? Well, it's the same thing that happens sciatica. But instead of pushing your elbow, something's pushing your lower back and it's shooting down to your foot.
Okay, so how does this change people's daily life?
Well, it changes where, in fact, just last week I had a patient that came in with a severe sciatica. She came in tears. She was hurting so bad, she could not even sit. She basically had to lay down on the bed, and she was just crying. Wow. So much pain that she had.
That's debilitating.
Yes.
Yeah, that says it all right there. All right, so let's talk about treatment options then. How did you help this woman?
Well, the first thing that I did was, of course, to make a diagnosis. Okay, and so after the history and physical examination, I found that she had classic symptoms. She had the shooting pain. The exam showed that she had decreased sensation and so forth. That's indicative of some sort of a disc herniation pushing on that sciatic nerve. The definitive diagnosis, I sent her for an MRI, and sure enough, it came back that she had a herniated disc between the fifth vertebrae and the first sacral vertebrae, impinging on that nerve. We brought her in 2 days later. She was still, she was very heavily medicated because of the pain.
Sure.
What we did for her, we gave her these injections that went close to that nerve root, reduced the inflammation. The inflammation pretty much went away.
Wow.
She had 2 treatments, 2 injections a week apart. This person was a marketing representative, and she traveled a lot.
Oh, boy.
She could not even go anywhere, and she's back at work.
Isn't that great?
And I sent her for physical therapy to make sure that she strengthens her core muscles, and if she can take great care of herself, which I'm sure that she will, she can, get back to a normal life.
Which is fantastic. Is a treatment like that, is it permanent, or do you have to keep coming back for these injections?
Well, this can be permanent if this, and it's a big if. So, for example, so what caused that disc herniation to herniate in the first place? Normally, it's weak core muscles.
Right. And
we sit a lot, we do a lot of things, and so that herniates, we get the inflammation ends up going away, physical therapy, and that disc can actually shrink back. So it can't be permanent.
So you have to take care of yourself after you get the injections.
Yes, you do.
All right, Dr. Gari, thanks so much. You can contact Florida Pain Relief Group to schedule your same-day appointment right now. Visit the website, floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. We'll be right back with more right after this.